Good evening, Professor Murphy. My name is Elizabeth Fisher, and I chose to do my informative speech on gestational diabetes. I have my speech outline. I have some visual aids, and I have my glucose testing kit that was provided to me. Pregnancy is a time of possibility and excitement. You and your partner are about to become parents. How exciting is that? You may celebrate by throwing a baby shower or preparing the nursery or folding clothes. You may wonder what the baby looks like, how it's going to be that first day when you get to hold that baby. The last thing you're probably thinking about is being diagnosed with gestational diabetes. And as the American Diabetic Association would agree, finding out you have gestational diabetes raises a lot of important questions. What is diabetes exactly? What causes diabetes? Who is at risk? How do you treat or manage diabetes? I'm here today to inform you, my audience, of my personal experience with gestational diabetes. I was definitely in shock. I've always been a very healthy individual. Why me? Why could you or your partner be diagnosed with this? My obstetrician, Dr. Keith, with Chesapeake Women's Care, immediately began to explain this disease to me and the treatments I will have to follow to ensure a healthy baby would be placed in my arms when the time is near. I was scared, especially the thought of having a miscarriage or a stillborn baby. I'll begin by explaining what gestational diabetes is. According to the Health and Wellness Center at Anne Arundel Community College, gestational diabetes is high blood sugar that develops during pregnancy only. It only refers to women who have never been diagnosed with diabetes type 1 or type 2 previously. Just like other forms of diabetes, gestational diabetes involves a defect in the way the body processes sugar, also known as glucose. Gestational diabetes has a number of characteristics that differ from traditional types of diabetes. One, the glucose levels in other forms of diabetes are a result of the pancreas being unable to process insulin and glucose. Gestational diabetes glucose levels in other forms of diabetes remain high because the pancreas does not produce enough insulin. However, in gestational diabetes, the placenta is working against the hormones with the baby and with the mother. The placenta provides the baby with nourishment throughout pregnancy, but with pregnancy hormones, it interferes with the baby's hormones. Now that we know what gestational diabetes is, let's look at a few causes for this disease, other than just the placenta. According to the American Diabetes Association, the placenta has a lot to do with this diagnosis, but there are quite a few other characteristics of this disease. Women that are at risk are overweight. They have a family history of diabetes. They have had a very large baby before. They've had a miscarriage or a stillborn that's unexplained. They're over 25, or their baby is surrounded with too much amniotic fluid. Or you could belong to an ethnic group that just has a higher risk of this type of disease, such as Mexican Americans, Pacific Islanders. How you figure out that you have this diabetic disorder is all women are pre-screened at 24 to 30 weeks of gestation. There are no symptoms of this disease, so the only way that you can be tested for it is if you go and have a glucose screening test. The first one you will get is just a 1 hour long glucose test. You drink a little bit of a solution, you wait an hour, they test your blood, and if your levels come back high, they automatically put you onto a diet for a few days, and then you go back and you have a 3 hour long glucose test. If your 3 hour long glucose test comes back abnormal, then you have been diagnosed with gestational diabetes. A normal glucose level should come back at a fasting rate at below 120. Mine was coming in at 260. So I obviously had gestational diabetes. Now let's talk about management and treatments. Management first. You will be introduced to this lovely kit where you'll have to prick your finger 6 to 8 times a day. First started in the morning with fasting, and you would prick your finger and register it. Basically, it would come up on here to let you know what your glucose levels were, and then you could figure out what your diet was going to be that day. Mine was pretty hard to manage, so I ate the same exact thing every day. I learned how to read labels. I had to measure everything that I ate, and the only thing that I could eat without having to write it down or measure it was raw vegetables. It's really hard when you're pregnant. You have to remain very active with this disease. So I continued to walk with my dog. I continued to walk across the street and try and swim in the heat of the summer. Kathleen Hooverot, she was the dietitian that I was recommended to. She explained everything to me, how to pack my food when I go out to eat, how to figure out how to eat things that would not blow my levels over. The ultimate thing that you want to do when you have gestational diabetes is to make sure that your levels remain at a normal level so that the baby will be born healthy. I have explained today a lot of what gestational diabetes is, the causes, the symptoms of this disease, and then of the management. I hope that you all have a better understanding of gestational diabetes, the causes of glucose intolerance, the fact that there are really no symptoms and the only way to figure it out is if you do take prenatal care of yourself. There really are no symptoms again, so you do have to take it very seriously because you can develop things such as preeclampsia or have that stillborn baby. The American Diabetes Association says that there are 700,000 women every year that are diagnosed with this disorder. I just happen to be one of them, and I certainly hope that all of you, if you're diagnosed with such a disorder as this, that you take it seriously to make sure that you too have a 6-pound, 12-ounce healthy baby boy, and you both come out of this disease healthy and happy.